and the other will be kanamycin C. Again, as we have said, these drugs, and just look at their structures, they'll basically differ in the type of amino acids that they are, in the type of the amino sugars that they have. If I look at tobramycin and kanamycin, I think this one CH2OH, NH2OH. So this ring I'm seeing is the same as that ring in kanamycin. So this ring here definitely is where there will be difference in that. There will be slight difference in that ring, so that they are different. So as I have said, the amino sugars are the ones that will differ. And again, we'll have a look at that. Again, it's the same thing. We had mentioned that. It's only to note again that one has 4 rings. So these are just examples to emphasize on what we have already discussed. The chemistry, spectrum, potency, toxicity, and pharmacokinetics of these agents are a function of the specific diamino inositol unit and the arrangement and identity of the attachment. So we are saying that the amino or the pharmacophoric cyclohexane group, which is the diamino inositol. The diamino inositol or the guanidino inositol is important in the activity. And indeed, it is important because you can see streptomycin is a diguanidino moiety derivative, whereas the others are diamino, one which has very good activity against the mycobacteria tuberculosis. So we are therefore saying the chemistry, the spectrum, the potency, the toxicity, the pharmacokinetics is dependent on the structure, in simple terms, dependent on the structure of this drug. Which pharmacophoric or which inositol do you have? Which inositol are we talking about? Is it streptamine? Is it streptidine? Which is it? And also the arrangement. You remember I did mention when we were looking at spectramycin, the arrangement is different. We have only 2 and they are fused. When you look at streptomycin again, which is indicated, has very good indication for TB, then you are finding you start with the aminocyclitol. The arrangement of those rings is completely different as opposed to the others where the aminocyclitol is sandwiched in between. So that arrangement also is important for the stability of that molecule, for the pharmacokinetics of that, for the activity of that molecule, just as we have said of the other drugs, because the arrangement will have an interference on the ultimate structure of this molecule. So again, the activity of these drugs, their toxicity, their activity, again, is structure dependent. The various aminoglycoside antibiotics are freely water soluble at all achievable pH values, are basic, and of course they will be basic because they have free amino groups, all of them. Whether streptomycin has a guanidino moiety. The guanidino moiety has 1 free amino group. So they will be basic in nature. They will be highly water soluble, as we have said, they are free water soluble at all achievable pH values, are basic and form acid addition salts. Indeed, even like streptomycin, you don't give it, you give it a streptomycin sulfate. Streptomycin sulfate is formed from the combination of streptomycin and sulfuric acid. So we are saying they are basic and form acid addition salts, are not absorbed in significant amounts from the GIT, and therefore are not orally active, as we have said, are excreted in active form in very large concentrations in the urine following the injection. They will be excreted in the active form because already they have very high water solubility, very, very high water solubility. So they really do not require metabolism for their excretion. So they are not orally active. They are mainly excreted as they are. They are basic in nature, highly water soluble. So these are facts that are very important and which we can be able to get indeed from just looking at the structure. When the kidneys are not functioning efficiently, the concentrations injected must be reduced to prevent accumulation to toxic levels. So there requires to be dose adjustment in renal failure or in renal when you have renal compromise, you do require dosage adjustment. When you give an RNA, primarily confined to the GIT. So sometimes you can give them orally to clean, in case you are about to do a surgical maneuver within the GIT. You can give them to clean the GIT, but they will definitely not be absorbed. So they can't be used for cleaning of the GIT. They are more commonly given IM or by perfusion. Recently, tropomycin has been sprayed into the lungs to successfully treat Pseudomonas aeruginosa infections in patients with cystic fibrosis. Again, you will definitely touch on that when you come to formulations. Of course, drugs, you can give them, you can formulate them, you can give them in different formulations, and normally you give them in different formulations for purposes of the different conditions that you treat. Different conditions, some are very severe. Of course, some of the depending on the locality also of the conditions that you are treating, and you really want to access. You want to access where the microorganisms are found. Therefore, you can do different formulations to allow for that drug to access the receptor of the microorganism. Remember here, the receptors are within the microorganism. So that's why we're saying you can give it in different formulations, but more often than not, IM. And that's what makes even streptomycin 1, it is injectable. You're injecting it IM, buttocks. Either you inject it on the buttocks or you inject it on the arms, where, and definitely it can be very painful. Like when you get drug resistant TB, you get about 56 injections. That is not easy. That is not easy. But again, we said, what choice would you have? You're either choosing between the pain of the injections or death. So of course, if you're wise, you would opt for the temporal pain, because of course with time the pain will also be over. So Yellow also saying the route of administration results in significantly reduced toxicity to the patient. This route of administration, the one we have said, the last one, whereby this one, where you spray it. You did mention when you administer a drug to a patient, is that you make sure it's a very specialized route of administration, very specialized. You are administering the drug to the site of action, then you do remit toxicities. That's what we're saying. This route of administration results in significant reduced toxicity to the patient. These agents have intrinsically broad antimicrobial spectra. So intrinsically, that is within them, but their toxicity potential limits their clinical use to severe infections by gram-negative bacteria. The aminoglycoside antibiotics are widely distributed mainly in extracellular fluids and have low levels of protein binding. So they are well distributed. They have a broad spectrum of activity. When you do your pharmacology, you will also talk about I think it's called postbiotic effect, whereby you ask yourself, you see, these drugs are quite polar, but somehow the body has a mechanism of being able to accumulate these drugs within the body. So although they have high water solubility and should be, you'd expect that they are cleared from the body very quickly, there is what we call post-antibiotic effect, whereby you find these drugs, like even streptomycin, is concentrated within the body, such that within the cells, the concentration of the streptomycin within the cells is usually higher than the concentration of streptomycin within the plasma at any one time. Once you start giving the drug, you find the post-antibiotic effect allows this drug to accumulate within the cells more, even when you have very low concentrations in the blood. And that allows these drugs to have a very good uh, dosage regimen. They have, like streptomycin, you give it once daily. And the only reason why you give streptomycin once daily is because of that post-antibiotic effect, where the body is able to concentrate this drug. And in concentrating this drug, because we have seen that this drug has a lot, very good extra, they permeate the cells very well, concentrated within the cells. And once they are concentrated within the cells, even when the concentration in plasma is low, the concentration within the cells is good, and therefore they are still able to penetrate the microorganisms and be able to kill them. And that's what we call the post-antibiotic effect. And for that reason, because of the post-antibiotic effect, you find a drug like streptomycin is given once daily rather than many, many times. Given once daily because of that post-antibiotic effect, where the cells are able to penetrate this drug, and the concentration in the cells or intracellular concentration is much higher than the extracellular concentration, where the extracellular is the plasma, and of course the intracellular is within the cells. So that has been of very, very great importance. And neomycin, again, all of this are, we have said they're naturally occurring. That is its structure. You can see niacinamide C, it has those two. We had already mentioned, of course, it will have the 2-deoxystreptamine. Then of importance is this drug which we call the tiomycin. The tiomycin, you can see there's some structural difference between the tiomycin and the others, but it is still a naturally occurring drug. The sisomycin is the one which is naturally occurring. Then you can see this R here. That R can either be a hydrogen. In sisomycin, it is a hydrogen. In the tiomycin, it's an ethyl group. And the tiomycin is a semi-synthetic derivative of the naturally occurring sisomycin. So the sisomycin still again is a naturally occurring drug. So we are saying the tiomycin is a semi-synthetic ethyl derivative of sisomycin, which again is isolated from it occurs naturally. Exhalation causes spatial hindrance. Again, we are going to look at this. We have 3 types of enzyme. You have the amino acetyl, we have the nucleotidyl, we have the nucleotidyl, the one for acetylation. So we're going to look at those. There are 3 enzymes. We haven't mentioned them. We're going to mention them. And these enzymes are important in bringing about. These drugs are very good at developing resistance. Not the drugs themselves, the microorganisms, sorry, let me put it properly. The microorganisms rapidly develop resistance towards these drugs. And they do so by changing some of the pharmacophoric centers. They change the pharmacophoric centers, and therefore the microorganism acquire resistance. And they can do that by adding a nucleotidyl molecule or nucleotide molecule, or they can do that by adding an acetyl molecule, or they can do that by adding a phosphate molecule. And of course, all those additions, remember when we talked about a drug being destroyed, destruction of the drug, whereby, remember we said you can destroy the drug through acetylation. You can also destroy a drug through phosphorylation. And sometimes there are some, like for the aminoglycosides, you do have some enzymes that are very specific, produced by the microorganisms, and they can add a nucleotide on the drug. And once they do that, the drug will cease to be active, and of course the microorganisms will have acquired resistance. So we are only saying when you introduce an ethyl group there, which we are going to look at later, it introduces steric hydrons. We have mentioned steric hydrons severally. When you introduce steric hydrons, that means the enzyme that is coming in to come and destroy this drug its accessibility will be hindered through addition of a big group. So the ethyl group here increases the electronic cloud, and in doing so increases the steric hydrons, so that the incoming enzyme, which is supposed to destroy the drug, is not able to destroy the drug, and therefore that particular drug remains stable even in the presence of those enzymes that are being produced by the microorganism. Therefore, we are saying that drug can have more resistance, have more stability. It has more stability towards the resistance that is brought about by specific enzyme. But as I have said, so it causes special hydrons. Special hydrons is this, of course, not the spelling HI. Special hydrons, all we are saying, it brings in steric hydrons. Special hydrons is the same as steric hydrons, and once it introduces steric hydrons, then that drug is destroyed by the enzymes we are calling the APH and the ATN enzymes, which under normal circumstances, for drugs that do not have a group there, they can easily destroy. Again, even when if we look at this double bond, we see the double bond means you try to remember what we have in kanamycin. If you look at kanamycin, it has a hydroxyl group at that position, it has a hydroxyl group at this position. Again, we see the influence of hydroxyl group at that position and a hydroxyl group at these positions. When you put this double bond here, you remove the hydroxyl group at position number 4 prime. Again, we are going to look at resistance, and we'll be able to appreciate that this drug we are calling the tiomycin has much more stability towards resistance when you compare it with a naturally occurring drug like kanamycin. So tiomycin is a semi-synthetic drug which has also some positive has some positive characteristics, or has improved stability towards resistance, or towards resistant molecule, towards resistant microorganisms. So it has stability towards microorganism. It has activity towards resistant microorganism. It has activity towards otherwise microorganisms that have acquired resistance to quite a number of the other aminoglycosides. So it is important, we still come back there, important to note that group there, important to note that ethyl group there in netumycin compared to sisomycin. Streptomycin, again, we have already said whatever is there, it has a different, its aminocyclito is different, or its inosito is different in that it has the 1,3-diguanidino inosito and not the kawaida diamino inosito. Again, it is naturally occurring. That is all that is important to note. The streptomycin is naturally occurring, and from there we'll move fast. This fast. Then spectinomycin, we have also mentioned spectinomycin. Spectinomycin, we can say it's an unusual aminoglycoside, again naturally occurring. The sugar portion has a carbon. Remember, I noted that you lose these are amino sugar. That's the oxygen. It's a very unique amino sugar. Again, you can see no substitution there. It has a methyl group there. It has a carbonyl group there. So the sugar portion has a carbonyl group and fused through glycosidic bonds to the aminocyclito portion of spectinomycin. Again, of spectinamine. Again, I had mentioned this. So this is a unique sugar. That unique sugar has a carbonyl group, and of course, it has its own amino. It has its own unique amino inosito, and it is unique in that, unlike in the other sugars like kanamycin, tobramycin, gentamicin, which have at the diamino, they have the diamino inosito. This one has a methyl. You see, it has a methyl amino. So it has a dimethyl amino inositol. So the substituent at position 1 and 3, it is a substituted amino group rather than just the amino group. So that is different. And of course, as we had already said, it has fusion rather than direct bonding through glycosidic bonds. So that group and is fused through glycosidic bonds to the aminocyclito portion, spectinamine. And because of that, it gives it its unique activity. It is used in single dosage against Neisseria gonorrhea. Again, because of resistance, a lot of resistance has developed, and therefore the drug might have lost a lot of its activity. And not only that, of course, you have better drugs that have a better route of administration. Nobody really wants the injection. Of course, there are those who believe once you're given an injection, it of course is more effective than the oral one. Of course, it is true, it can be more effective because you are delivering the drug. Sometimes if you give it IV, delivering the drug directly into the blood, there are no issues of absorption and so on. There are no issues of fast. So you are delivering a known high amount concentration of the drug directly. But all we are saying is that this drug had a good activity, but again, there has been development of a lot of resistance. And number two, of course, there are also better molecules that have been developed, but nevertheless, it can still find some use in Neisseria gonorrhea. Aromomycin, again, naturally occurring. That is what we'll say for now. We have mentioned almost all of them. So those are the, and all you need to understand is to understand the glycosidic bonding, the differences between the amino inositors. And of course, now as we move on, we'll also understand the differences between the structures and the role of that difference within the structure to the biological activity, to the stability, and even to the identification tests we do for these different drugs. You will find that the amino inosito in a specific drug will allow us to identify it very readily. The fact that the streptomycin has a unique sugar, which we are calling streptose, that sugar renders the streptomycin a little bit unstable, more unstable in acidic and basic media compared to the other aminoglycosides. So again, that's why we say the toxicity, the stability, the identification, the spectrum of activity are all structure dependent. But when we look at the spectrum of the activity of these drugs, they are broad spectrum. We had already mentioned them, that system. And of course, they do have activity against mycobacteria tuberculosis. Systemic infection caused by aerobic gram-negative bacilli. Again, all this, most of this, you will be able to do in pharmacology. They can also be used in amoebic dysentery. They can be used in pneumonia, urinary infections caused by pneumonia, Pseudomonas aeruginosa. They can also have activity against both gram-negative aerobic cocci, except staphylococci and anaerobic bacteria. They are less susceptible. So they have a good range of activity. But again, we have said, and I'm repeating it again, that the major danger we have against antimicrobial agents is resistance. That most of the microorganisms have changed, they undergo mutation, or they become then code for different enzymes, and some of those different enzymes have the ability either to destroy the drug or to occupy, to, to destroy the drug. Sometimes they have the ability to change the receptor, as we said last time. And once they change the receptor, cause mutation of the receptor. Once the receptor changes, then the drug cannot bind. The drug cannot bind the microorganism. And we had discussed all that, and we are saying that the danger of most of the antimicrobial agents is resistance. And that's why a lot of care has been to be taken in their use. There must be rational use of antibacterial agents, of course, which is not there. There is no use of the antibacterial agents, but it has to be there for purposes of controlling resistance. But nevertheless, at least you prevent it, you delay it so that the drug can be used for a little bit longer. But somehow, eventually, the microorganisms have a way around it. But you can't be able to delay it so that the drug can be of use for a much longer time. Again, remember, as we have said of TB, resistance can mean death. Resistance can be very expensive in terms of life, in terms of treatment. So we are still looking at the aminoglycosides. We have mentioned their very wonderful range of activity. Of course, we have mentioned the danger of resistance. And most of the resistance can be of different ways of resistance, but one major root of resistance is the fact that the microorganisms are able to produce three different enzymes. And the three different enzymes are able to destroy, or they are able to destroy. They are able to destroy some of the very important areas which are considered to be pharmacophoric centers of this drug. They are able to block those areas, and in blocking those areas, or even to change those areas, they're able to change those areas through either acetylation, as we have said, addition of a nucleotide, or phosphorylation. They change those areas, and once they change those areas, then those areas which are needed to bind to the receptor, which is the microorganisms, the areas after they are changed, they cannot bind the microorganism, and of course, there will be resistance towards that specific microorganism. So we are looking at now the enzyme. We have microbial resistance against aminoglycosides, and I've said there are different methods, but the main one is through change of the drugs. We are saying resistant strains have emerged against streptomycin, kanamycin, and gentamicin in the clinic. R factor is responsible for the production of aminoglycoside deactivating enzymes. And do remember, we've done this, USA, I don't know whether you are doing it in pharmacology or in medical microbiology, it was did it somewhere, where we discussed resistance, how you can transfer resistance from one microorganism to another. We, of course, there's those ones we call conjugation, where you just transfer. You have the R factor. The R factor encodes for the resistant gene, and that R factor can move from one resistant microorganism, and it moves to the other through those bridges that you form through conjugation and so on. So that is a major problem, that the R factor is responsible for production of aminoglycoside deactivating enzyme. And once the enzyme is produced, it changes a particular position of the drug, and therefore the drug cannot bind, or it cannot bind its receptor. And as I have said, we have three main enzymes. We have the acetyltransferases. These ones will add an acetyl group. You have the phosphotransferases, or the ones which will do phosphorylation. You have the nucleotide transferases, or those that will add a nucleotide. These ones will add a nucleotide. This one will add a phosphate. Those ones will add an acetyl group. And therefore, we call the amino acid acetyltransferase, AAC. We have the amino, actually not amino acid, aminoglycoside. So even this one is aminoglycoside, phosphatile transferase, APH, and also you have the aminoglycoside nucleotide transferase, or aminoglycoside nucleotide transferase. This is aminoglycoside phosphotransferase and aminoglycoside acetyl transferase. So these are the three main enzymes, and that's from their name you can tell what they do. As I have said, one will acetylate, phosphorylate, and add a nucleotidyl group, and therefore deactivate the positions, all coat those positions that are phosphoric. They are important positions that are required for the activity of that drug, or for that drug to bind onto the receptor. And now